it's time now for us to talk about medicine. I'm sure this is not the first time you're seeing this, and I've been joined in the studio by Dr. Ruben Tete Agbo. He's usually here to educate us on a number of issues and the things that this Nitro MX helps to alleviate. But first of all, let me welcome you into the studio, Dr. Ruben Tete Agbo. He's a medical consultant with Phytotec, and it's a pharmaceutical company producing 100% herbal drugs. Yes. And I must say, though, you gave me this the last time and I tried it, and I have some positive things to say about it. But let's start the conversation by asking you, what exactly, to keep our audience up to speed, what does this Nitro MX drug do? All right, okay, so good morning to your cherished viewers. Yeah. All right. Okay. So good morning to you from Phytotec Limited. In fact, Phytotec Limited, what we want to do is to produce medication that will be able to help patients in order for them to live healthy. And that is the reason why we have one particular medication called Nitro MS. So this Nitro MS was produced purposely for this. It is to relax the blood vessels. So there is a particular active ingredient in there called nitric oxide. Now, this medication that is Nitro MS, whenever you take in the Nitro MS, what it helps is it helps the blood vessels to relax. Helping the blood vessels to relax. Now, the blood is able to flow very well throughout the system. Now, when your blood is able to flow very well throughout the system, it means that now all the body parts will be able to function very well, including your brain, your penis, every part, your heart, every part. Right. So that is what the Nitro MS actually does. It improves blood circulation. So yes. Yeah, everywhere there's blood, it helps to improve that. Exactly. So the last time we spoke about hypertension, we spoke about stroke. Yes. But you tell me before we came on air that there's an interesting testimonial, a story about someone who had great things to share. Let's start off by telling me that story. All right, okay. So we had this patient. Most often we also do telemedicine as well. So there's this patient, I wouldn't mention the name, but his age is 57 years, and then he's somewhere in the eastern region. I wouldn't also mention the town that he's coming from. But he was having these medical problems. So he has been having hypertension for the past 10 years or more than 10 years. And then he also had sudden brain attack, or purposely or mostly we know it as stroke, for the past 5 years. Most often when he checks his BP, the top one, that is what we call systolic blood pressure, is around 170 and above. And then the down part, that is what we call the diastolic, is around 100 and above. And then also currently he was also taking antihypertensive medication, that is orthodox. I wouldn't also mention the brand also, and then the dosage that he was taking. So he called. When he called me, I was like, oh, doc, please, I want to talk to you. And I said, okay, fine, you can talk to me. Why did you call? And then he actually wanted to know, do I have to stop taking my Nitro MX? And I said, oh, why will you stop taking your Nitro MS? Because he was worried that he was going to stop taking the Nitro MS. I said, no, you couldn't stop. So he now told me the story behind what Nitro MS has done for him. He said, oh, he's a stroke patient. He was also having hypertension. When he went to the pharmacy, he has been given Nitro MS, and he was taking the medication. It was helping him from 1st of April 2024. And all of a sudden, he needed to stop because the pharmacy... just this year? Oh, yeah, just this year, April. Okay. After I have come to the studio. Yeah. So that is when the patient actually started taking the Nitro MS. Okay. So the pharmacist was like, oh, you take it for 30 days and that's all. But apparently, the Nitro MS was actually helping him. So now, he doesn't know why he should stop taking the Nitro MS. This is what he was having. He was having slurred speech, so he couldn't talk like the way you and we can talk. And then also he was having a bad memory also. He couldn't recall past events immediately. And then also he was having weakness in both arms. So he couldn't lift up his arms and everything. But when he was taking the Nitro MS, it was helping him. Even though he has been taking the orthodox antihypertensive medication for more than 20 years, but nothing was really happening, but he was still taking it. So I said, oh, you can continue with the Nitro MS. However, we will win you off the antihypertensive medication that is for the orthodox, but not now. So you can still be taking the two products together, but we know what Nitro MS is going to do for you. Right. And then he continued with the Nitro MS, and to our amazement, we even have a testimony for that. Yeah, and I'm actually looking at the picture, the message that the person sent. Yeah. And he says, good afternoon, doctor. I just went to the hospital to check my blood pressure, and it had dropped to 116/64 from 170. I've taken Nitro MX in addition to my BP medication for a month now. This is a significant breakthrough for me. I called you some time ago and you advised that I take Nitro MX, like you were just saying.
Yeah.
After a minimum of an hour after taking my BP medication, can you use this message to educate people? Because Nitro MX really works. My libido has also greatly improved, and my wife is even surprised.
Yes.
Yeah.
Yes.
So that's great to know that you're
Yes.
producing this right here in the country, and it's doing amazing.
Yeah.
Last time you came here, though, we didn't say how much this pack cost. So how much is this?
All right. Okay. So this is the pack of 10. So in the pharmacies, you get it around 60 cedis for the pack of 10 as well. So you get it. So this one will last you for 10 days. This one will just last you for 10 days. And then you have to buy 3 that can last you for 30 days. So it depends on the pharmacy that you go to, and then you can get the price. Some may have it as 55, some may have it as 60, some may have it as 65. But the average price is 60 Ghana cedis.
So do you take this just as a supplement to improve your blood circulation, or do you have to have a problem that you want this to solve for you?
All right, okay. So you can also take Nitro MS as a supplement.
Okay.
So not necessarily you are having hypertension or any other blood-related problem.
Right.
So you can take it just to boost your system. You can take it to relax your blood vessels. Blood is able to flow very well for you. Now, if you are having, with that one, you take 1 capsule daily, every day. But if you are having a condition like hypertension and co, that is when you talk to the doctor, considering the medications that you're already taking, you may take 1 capsule a day, or you may take 2 capsules also a day. That is what Nitro MS can do for you. So not necessarily you are having a condition, but if you don't have the condition itself, you can also take the Nitro MS also. Dr.
Agbo, thank you for coming. So how do we contact you?
All right, okay. So if you want to contact me, it's on the screen, but you can contact me on this numbers: 024-649-0116. 024-649-0116. When you contact, we'll be able to converse with you and then to see how best we'll be able to solve your problem. Anish says something, and I always want to say this. It says that awareness is the first step to healing. When you become aware of the disease condition that you are being surrounded with, that is the first process that starts with healing. Therefore, you are aware that there are disease conditions around. There are hypertension cases. People are suffering from stroke. People are going through a whole lot of things. And this is why we have produced Nitro MS for you. That you need to take Nitro MS in order to prevent all these diseases in the future. Not when you are now about to enjoy your retirement with your money, then you have to use all your money to be taking care of your health. Today, you can start, and tomorrow you can live a healthy life.
Thank you so much. And just to clarify, is there any age restrictions, age limits on people who can take this drug?
Okay, so if you are from 12 years and above, you can take the medication.
Okay,
so less than 12 years, we wouldn't want you to take the medication. And then also when you are lactating, we wouldn't want you to take the medication as well. Or you are a pregnant woman, you shouldn't take the medication. Aside these people, anybody at all can take this medication.
Thank you for coming. And this is a great testimonial. This is a fantastic story that you shared. So, I mean, for our audience, if you're looking for something just as a supplement to improve your blood circulation, then this is Nitro MX. My producer is saying in my ear that he should leave one for him, but I'll take it. I'll give it to him. Thank you so much.